Hey guys, welcome back to my channel. I'm Amanda Shee. I'm an anesthesiologist and intensivist. And on my channel, I talk about life advice, life in general, study tips, and a variety of other things. Today, I'm going to be talking about something that I am in the process of preparing for, and that is my oral boards, also known as the ABA, which is the American Board of Anesthesiology, applied exam. So just to back up, to become an anesthesiologist, a board certified anesthesiologist, you have to complete 3 types of exams. They are 3 parts. So the first one is called the basic exam. It is a written exam. You take it after your 2nd year of residency or after your CA1 year in the summer. The second exam is called the advanced exam. It is another written exam. You take it this summer after you graduate from residency, so after CA3 year or your 4th year of residency. After you take your advanced exam, if you've passed, you are then able to register for the applied exam, which is also known as the oral boards. Unlike the basic and the advanced, the applied exam is an actual face-to-face exam where you get presented with a case presentation, and from there you need to answer questions about your management for the case. The applied exam is made up of 2 components. There is a standard oral examination and the objective structured clinical examination. And I'm cheating, I took some notes so that I can remember to talk about specific things with you on the exam. Oral boards are probably the scariest exam for an anesthesiologist to take because of the reality that this is like no other exam we've ever taken, and the pass rate is lower. That also means the fail rate is higher for people who take it. So as a result, it's a high stress exam. It is something that we typically don't encounter, and as a result, that makes it a scarier type of exam. Its structure is actually pretty straightforward. So before the pandemic, we would fly to the testing center. You would be assigned to go into a room with 2 examiners, and you'd go through 2 35-minute sessions with 2 examiners. The other component of it was the OSCE, or the objective structured clinical exam, OSCE. And that component is made up with multiple parts, which is 7 stations lasting 8 minutes each with a 4-minute break in between. Now we are living in the pandemic. I was actually supposed to take my oral boards last June, and because of the pandemic, it was canceled. They then announced that the oral boards would be virtual for the year of 2021. And so I've been rescheduled for April of 2021 in a virtual format. I've already gotten my date and my times for that. So I decided after I had gotten that email that it was time to come up with a real study plan. To back up a little bit, I just want to go over the structure again of how the oral boards looks like. So part 1 is the standardized oral examination, and you can have your standardized oral examination before your OSCE component, or you can have the OSCE before your standardized oral examination part. It's just dependent on their scheduling. But typically the oral board part that people know really well is the standardized oral examination part. That is, like I alluded to earlier, 35 minutes, 2 sessions. During one of the sessions, you get a long stem. And when you get the long stem, it gives you a ton more information. So you get like a little paragraph of information, and then you get much more background about their past medical history. During the long stem, you will encounter intra-op and post-operative scenarios. The other 35 minutes will be spent doing a short stem. The short stem instead provides only 1 paragraph, pretty minimal information, so that you can delve into the preoperative component as well as the intraoperative component. At the end of both parts, there is an opportunity for grab bag questions. So these can literally be anything, not related to the case whatsoever. You know, if your case was a pregnant woman undergoing an emergency C-section, your grab bag question could be about a a male in the ICU with ARDS, or a pediatric patient undergoing a hernia repair. Anyway, the point is, the grab bag question can cover anything. That 70-minute period is the bulk of your oral exam, and as a result is kind of the more important, I'd say, or the scarier of the two components. The OSCE part is a relatively new thing. It's only a few years old. As I alluded to earlier, it's 7 stations. You're going to go through 7 of these little scenario things, and each one lasts 8 minutes. Now, the OSCE is broken up into 2 separate types of stations. One type of station is the communications and professionalism component. Within that part, there are 5 kinds of stations that exist. So that includes discussion of treatment options and informed consent, peri-procedural complications, ethical issues, communication with other professionals, and practice-based learning and improvement. The other component is the technical skills part. Under technical skills, there are 3 things that are listed under there: interpretation of monitors, interpretation of echocardiograms and surface ultrasound of lung, and application of ultrasonography. Now, in the outline that I had downloaded from the ABA website, they specifically said that the relevant anatomy using ultrasonography actually will not be part of the virtual applied session. So I will not be a part of that, but if you're watching this and we're now in 2022, I can't promise that they haven't updated it already and they're going to be including it in your exam. And just to make it clear, everything that I'm telling you about the exam format is on their website, and I will include it in my blog entry that accompanies this video, so you can click on it and review it yourself. I highly recommend that you go through the provided materials on the ABA website to get an idea of the flavor of questions, the way that they're going to be asked, as well as under the OSCE component, there's a long document that really goes into deep details about what to do, how to prepare for these things, and gives you enough information that you can really go into the exam after reviewing that and kind of reviewing some of the areas after that that you may need help with, and then you can just take the exam after that. That's what I think, at least. The next part of this video, I just wanted to go over the resources I'm going to be using in order to study and the way that I'm using these resources, and then moving forward what I'll be doing. Now, I'm currently recording this and it's December, so I have about 4 months of study time in order to prepare for the oral boards. The things that I have found online that and other senior residents and graduates that I know have used in the past include Ultimate Board Prep, and honestly, that's probably the most commonly used preparation material that I've seen around. I haven't had a chance to really delve deep into some other resources that are available, but I'm going to start doing that more seriously in the next coming weeks, because I want to make sure that I have a really broad base of materials I can study from, and make sure that I have information and comfort level with a lot of the subject matter and the concepts that I need to have down really well as I prepare for the exam. So first and foremost, Ultimate Board Prep has problem sets, and their problem sets are really helpful because they give you a short and a long stem, and then they delve into great questions and really detailed responses for each of those questions. The reality is the ABA exam does not expect your answer to be super long the way that Ultimate Board Prep has formatted theirs. But at the same time, I think it is important, I think it makes sense to learn the material into greater depth so that when you're faced with a anxiety-provoking situation like oral boards, you can just dig superficially, pull out an answer, and say it. One of the things that I've heard really frequently from senior attendings or other attendings that have given me advice about passing the oral boards is that it's important to just say what you know and not get into the weeds about this 2019 study said so-and-so, so maybe you could consider so-and-so and so. The important thing is to do conservative and clinical practice in such a way that is safe. That's the goal. The goal is to provide board certification to individuals that will be safe anesthesiologists. So as a result, your responses and answers should be whatever you would need to do the safest thing for that patient, not necessarily what you do in your practice every day. It's important to think about these things as well as to realize that, and this is something I've heard over and over again, that it's okay to say, I don't know. There's going to be some questions that are way over your head or that you just didn't spend enough time studying or you freeze for. And at a certain point, you have to realize that there's going to be other questions you can answer and that you may know better. So it's okay to just say, I don't know, and move on to the next one. That's at least some advice that I've been told. Now, besides Ultimate Board Prep, which has a great number of problem sets, and if you go to their website, they have a sample one, so you can check out whether you like that or not. I had wanted another resource in case I kind of get sick of reading that particular type of resource and studying off that resource. So a while back, I actually purchased Yao's Anesthesiology, the Problem-Oriented Patient Management book. It's a book that I've seen recommended by a lot of people, so I wanted to get it. And I actually got it a couple years ago, but have been finding that when I am sick of going over problem sets and reviewing them and doing all that, that this is a nice textbook to just kind of read through and review materials on. I'm trying to complete both resources by the time of my oral boards, but as you can imagine, many of us that are taking oral boards this time around have a full-time job and other things going on in our lives. So trying to study for all of this has been a challenge. So in my blog, I have talked a lot in the past about how I have studied for my USMLEs, how I've studied for my anesthesia boards. And now in terms of the oral boards, I've kind of changed my approach to studying. So in the past, I used to have a notebook, like literally a spiral notebook, and would go through a question and then write down exactly the concept that I didn't understand or write down things that I had to memorize. I found that I went through a lot of notebooks and I never actually kind of re-reviewed all those notebooks. In fact, they were kind of like a hodgepodge of things. And as a result, it didn't feel like I was optimizing my approach. I've been thinking about switching over to an iPad-based way of studying and have decided to go ahead and do that for oral boards because I bought my iPad in order to use Peloton, and I might as well use it for note-taking as well. So I currently use OneNote now, and it's been really nice trying to transition everything to a digital platform because I've also been taking notes on when I record my YouTube videos or come up with blog entry ideas. I've been recording those into a single place in which I can keep track of everything and organize it. So I currently have a notebook of just ultimate board prep type cases. And what I will do is that I will go through a case, and when I see the case stem, so short stem, long stem, I go into OneNote in my iPad, and I have purchased a Apple Pencil, just the first generation one, so it feels like I'm writing. When I go ahead and review an exam, what I'll first do is come up with my little map of what I need to be thinking of based on the information given to me. So that map is based on a YouTube video I watched, which I will link below, in terms of how to organize my thoughts. And I think that was kind of helpful for me, at least. So it includes specific organ systems, so like neuropulm, cardiology, GI, endocrine, and other. And after reading the stem, what I'll do is jot down specific things related to that patient under that organ system, and anticipated things that I might run into. So you can kind of see some of it here, and it's not helpful to see this particular one, but as an example, this particular case, I went ahead and wrote down under neuro because the patient may not be cooperative, that I'm worried about if they'll cooperate with a typical IV induction anesthetic. Under palm, the patient had an anterior mediastinal mass. So I'm thinking about their airway. I'm thinking about other things. They also had severe asthma and were current smokers. So that was listed under there. For cardiac, I included Down syndrome was one thing there. So cardiac defects and other potential cardiac arrhythmias would be listed under there that I anticipate I could be asked about. Under GI, the patient had mentioned that they had severe GERD. And then for other, this was a young woman, so I listed on their beta HCG. And then when I was given vitals, I wrote down their vitals there as well. So this was just one way that I found in order to organize my thoughts and try to anticipate what I'm going to be asked by the examiner so that I can prepare some answers and some thoughts when I'm thinking clearly rather than when I'm under the stress of having someone ask me the question. And then after I write this all down, what I will do is then read the questions, come up with an answer in my mind, read the response, and write down any notes that I have about that response, and as well kind of dive deeper into anything else I might need to memorize. So one of the things I've always struggled with memorizing is the Glasgow Coma Scale. So now I have the Glasgow Coma Scale in my iPad under its own sheet, and I just write it out multiple times in order to memorize it, because I have a really hard time with just rote memorization. So writing it really helps me memorize it. And so that's one of the things I've been doing. And my goal is then, after I've written out all of this information and taken some notes, that I will go back and review it. If needed, I'll make some Anki cards to be able to memorize some of the other tables and other things that may come into play later, as well as some of those other really esoteric disease processes that I haven't seen in a while, and will need to review some of their intricacies in terms of the anesthetic management of those patients. I will say Up to Date actually has a lot of really nice articles anesthesia-wise, so whenever I'm stuck on something or I just I want to refresh my memory on something, I will go to Up to Date for their articles in order to figure out some of the things I might be missing or figure out what I might need to study or memorize about that topic. Many of you guys know that I like to use a Google Docs schedule in order to figure out where I'm at and to keep me accountable for my studying. I did make a schedule for myself for this, and what it has is really not like what I had for my step one. Since I don't have dedicated time, none of us have dedicated time really anymore after step one. What I instead do is I create a Google spreadsheet, and I'll show it to you here. And I come up with all the dates left until my exam, and I come up with the particular problem sets that I will be using or the resources I'll be using, and put in there how many pages are in that resource. Then I go ahead and enter in each time I do the work, the pages that I've completed and reviewed in order to see what my countdown and what's left. So I've kind of calculated in my mind how much I need to get done per week in order to get through all my resources. But in reality, there's going to be weeks that I do more, and there's weeks that I just don't do anything. And that's just how it's going to be. As a full-time attending, I'm in the OR, I'm in the ICU, I still do some nights. It's gonna have to wait. There's certain days that when I'm off, I'll go ahead and do more studying, but when I'm on service, I find that it's gonna be challenging, and I'm probably gonna need to figure out something with flashcards or something else to help me keep studying as I get closer to the exam. Finally, the other important thing about oral boards is mock orals. I actually, through my residency program, have done a couple of mock oral exams with one of our faculty members that is a ABA examiner. That particular individual is very intimidating, and we typically do these sessions after a 24-hour call. So I can't say I've done very well on these sessions, but it was a really great way to simulate what the real exam is going to feel like. And I anticipate that my institution will put on another mock oral board exam session that I'll participate in, or I will reach out to that particular attending or some of our other ABA examiners to do a mock exam just so that I can simulate what it's like. And because this year it's virtual, I don't actually have to practice it with the examiner in person. So it's kind of nice. So I can practice it at home after I schedule this with an examiner, or I can find some friends that I could do a practice session over a video conferencing platform like Zoom or something. So in some ways that's been nice. I'm glad that this is a virtual format, that I don't have to worry about flying out to North Carolina, especially in the midst of a pandemic. And we'll just have to see how things go. So I anticipate that my studying will, maybe my study plan or my progress or things that I do will evolve in the next 4 months. So stay tuned through my YouTube channel or on my blog for updates on how my board studying is going, what other new resources I plan on using, and anything else. Thanks for joining me, and I'll see you next time.